Good afternoon, Hattiesburg. Thanks for joining us for this COVID-19 briefing for Wednesday, December 29th. We'll start with today's numbers. In the hospital today, between Merit Health Wesley and Forest General, we have 28 people who were COVID positive. I will say on this one as well, understand that both our hospitals serve a wide number of counties. Forest General serves 19, Wesley serves 18, and so of those 28, 4 are from Lamar County and 6 are from Forest County. Also, of those 28, 10 are in the ICU, and of those 10, 3 are on ventilators right now. So just a little bit more about that. Of the 28 in hospitals, 8 were fully vaccinated. Of the 10 in the ICU, 1 was fully vaccinated, and of the 3 on ventilators, 1 was fully vaccinated. Just compared to a week ago, we are seeing a rise with this current variant. We were at 18 last Wednesday. We're at 28 today, and our ICU numbers are remaining the same. We did have 1 new death. After several weeks of not having any new deaths, we have gone to 263 in Forest County with 140 in Lamar County. Today, 107 new cases were added, and Lamar County saw 79. This is by far the most we've had in quite a while. And just in terms of the 7-day average, and we say 7-day average, this is the number. This is the average on the last 7 days of new positive cases. And so today that number stands at 42.86. In Lamar County, that number stands at 36. And just compared to a week ago, you can kind of see the change. A week ago, we were at 12.71 7-day average. Lamar County was at 14.28, and obviously those have both jumped quite a bit over the last week. Just some vaccination updates. In Forest County, there's 40% of the population is now fully vaccinated, with an additional 5% having received 1 dose. That number of that difference between the fully vaccinated and the 1 dose has kind of stayed the same over the past month or so, and so we really do encourage those. If you've gone to get 1 dose and haven't gone back for your second, please do that to protect yourself. Lamar County, much better on both fronts. 57% are now fully vaccinated, with an additional 6% having received 1 dose. So today we had a weekly conference call with all of our healthcare professionals and emergency management, health department, as well as our universities and schools. I'll give you one kind of overall statistic, and then we'll talk about some broader themes. Over the last several weeks, Hattiesburg Clinic, as well as any other outpatient provider, has seen a big increase in the number of just overall infection numbers. While that hasn't translated yet into these runaway hospital numbers that we saw during Delta, it's something we have to keep an eye on. So of those new positive cases over the past week or so, 68% of them were unvaccinated. 25% of those new positive cases were either 1 dose or even fully vaccinated, which points to this idea that after 6 months, you start to see some waning antibody numbers to protect yourself. And then, of course, 7% of the new positive cases were fully vaccinated and had a booster, which goes to the whole point, is that, yes, you can still get COVID. You're less likely to get COVID if you're vaccinated, and especially if you've had a booster, but you're really less likely to have serious illness because of COVID if you are vaccinated and get a booster. Speaking of testing, I know that that's kind of a concern right now. The Forest County Health Department is testing 8 to 5 Monday through Friday, and you can do that at the 360 shelter, which is at 946 Sullivan Drive. You can schedule your appointment at covidschedule.umc.edu. Of course, Simrai has testing Monday through Friday at their Family Health Center on Old Airport Road in Palmer's Crossing, as well as their minor care clinic near Forest General on Sundays and Saturdays and Sundays. Hattiesburg Clinic, they are transitioning cough and fever clinic away from testing to just doing the antibody treatments, what they've been working on over the past year, what they now have is testing capacity at any primary care facility that Hattiesburg Clinic runs, including their immediate care clinics on Hardy Street. So feel free to use that as a resource. Merit Health Wesley, also any primary care location that they have, they can do COVID testing, as well as their internal medicine clinic on their campus on Asbury Circle. The bottom line is Omicron variant brings a new wave of COVID infections. It is here, and it is spreading. And based on the data in the UK, it appears to be milder than the Delta variant with some slightly different symptoms. And according to Dr. Brian Batson at Hattiesburg Clinic, so far in the UK, 168,000 people have contracted the Omicron variant. And 132 of those have had to be hospitalized, and they've had 14 deaths. Of course, the UK is a couple of weeks in front of us on this wave right here. And while the numbers point to that this variant is not as deadly as the Delta variant, and it also points to the fact that even with high infection numbers, it's not translating into these really high hospitalization and ICU numbers that we saw during Delta. It represents another public health threat in our fight against COVID-19. Throughout this pandemic, we've tried to focus on giving you good information. Yes, some tough decisions were involved early on, all with the goal of trying to get us to the point where we had a reliable therapeutic or a vaccine. But once that time arrived where we had a widely available vaccine, Pfizer, Moderna, J&J, our focus and our message began to shift to personal responsibility, taking care of yourself and your loved ones. That means doing the right thing. It meant doing the right thing then and getting the vaccine. And now it means, when we talk about doing the right thing, going and getting that booster shot if you're 6 months past your second shot. It also means doing common sense things like wearing a mask when you're around people when we're in periods where COVID numbers are starting to rise again. I know we're all tired, and this looked like the holiday season that we were finally getting back to normal. However, as variants pop up, at least in the foreseeable future, we're going to have to do those things that mitigate our risk of getting sick and spreading that to someone else. That means getting good information and then acting on it. And I encourage you, if you haven't seen my interview with Dr. Batson, to go back and check out yesterday's video on this page. Personal responsibility also means making good decisions when it comes to New Year's Eve. A lot of people are planning on going out, and many of them are coming downtown for midnight on Front Street. I strongly advise you to take precautions and do those things that can protect you against COVID-19. If you are not fully vaccinated, it's probably not a good idea for you to be around a lot of people right now. If it has been more than 6 months since your second shot, you need to get a COVID booster shot now. And even if you are vaccinated and you've had your booster shot, you may want to consider wearing a mask for additional protection. 2022 can be better than 2021, and I certainly hope it will be. But we don't need to start the year out with a lot of people getting sick and hospitalized or worse because we didn't do some basic things to protect ourselves. So if you go out, make good decisions. And as we end what could be our last COVID briefing of the year, I'll remind you to wash your hands, take care of yourself mentally and physically, wear a mask when you're around others, please get your vaccine and your booster shot. Most of all, just be kind. Have a good day.